good afternoon. This is Lisa Kihos. I am a licensed paramedic, and I am going to be instructing the human body amongst other topics for you guys today. And just keep in mind that at the end of this module here of the human body, there will be a quiz on the information that is provided. Without further ado, let's begin. So today we're going to learn about some simple knowledge in the anatomy and physiology of the body that consists of the airway, the heart, vessels, blood, lungs, skin, muscles, and bones as your foundation for emergency care. We must understand the basic structure and functions of the human body, which is going to better allow you to assess the problem of what the patient is experiencing, provide an adequate patient examination, and then communicate your findings to others when the fire department or other EMS or police officers arrive to the scene. We want to make sure we know these foundations and the fundamentals so we can provide the appropriate emergency treatment. When talking to a patient and identifying where their illness or injuries are, there is a standard anatomic position in which the person is standing and facing you. Their arms are at the sides and their thumbs are pointed outward. When you're standing looking at the patient, the front of their body is the anterior and the back of their body is the posterior. When looking at this patient, there is an imaginary midline that starts from the top of the head that goes all the way down to the feet that separates the patient's right and left halves of the body. That line is referred as the midline. There are other terms used to describe injuries associated with the patient, and the terms are as follows. You have medial, which is closer to the midline. You have lateral, which is away from the midline. Proximal is a term used to describe an injury closer towards that midline, and distal would be further away. Any terms used for something closer to the head would be superior, and any injury closer to the feet would be described as inferior. Here in this diagram, you can see all the definitions of the terms just explained to you. Keep in mind that the patient's right is going to be opposite of your right. And here you can just review that the anterior is the front, superior towards the head, and inferior towards the feet, or away from the head. Proximal closer to that midline, and distal is further away. Let's use those terms in a sentence. So some examples are: the head is superior to the neck, the navel is inferior to the chest, the elbow is proximal to the wrist, the foot is distal to the knee, the skin is superficial to the bones, and the lungs are deep to the ribs. Another important system of the human body is the respiratory system. The purpose of the respiratory system is to bring oxygen into the body and remove the waste gas, which is also known as carbon dioxide. Structures included in the respiratory system are as follows. You have your upper airway, which constitutes your nose and mouth. Then you have your trachea, lungs, ribs, bronchi, and diaphragm. We'll talk about those more closely in the next coming slides. The airway consists of the nose, the mouth, the throat, the larynx, the trachea, and other passages within the lungs, which are called bronchioles and alveoli. Let's get a closer look here. In the respiratory system, you see the upper airway. We just reviewed previously on the previous slide. We have the nose and mouth. In that upper airway, the nose space is called the nasopharynx, and the oral space is called the oropharynx. That's why we get those terms for oral pharyngeal airways or nasal pharyngeal airways. In this cross-section view, we also see that the trachea is located beneath the chin in that long tube-like structure in the red. We have our lungs, and protecting our lungs are our ribs. Then below our lungs, we have that pink structure, which is also known as the diaphragm. Also, the little tree branch items within the lungs are called the bronchi. And off of those, there'll be the alveoli, which we will see in the next coming slides. So again, we have the nasal cavity, nasopharynx, the mouth, the larynx, trachea, and lung, all part of the respiratory system. On the left side of the diagram, you see the esophagus and the epiglottis. The epiglottis is a skin-like flap that is used to cover the opening of the windpipe to prevent food from falling down, causing pneumonia, choking, or aspiration of food into the lungs. Here, oxygen and carbon dioxide are exchanged in the alveoli and tissue. So, as you can see in the diagram, you have your lungs, then you have your bronchus, which are the two, it's like the long trachea tube, and then it branches off into left and right sides, which those are called the bronchus. And then you go down into like a tree-like branch, which is called the bronchioles. And then you have the grape-like sacs called the alveoli. Those alveoli are specific to where the gas exchange occurs. So on the diagram on the right, you see as oxygen comes in, carbon dioxide releases upon exhalation. As air is inhaled, the diaphragm and the chest muscles contract. As air is exhaled, these muscles relax. They all work together in one fluid system. The circulatory system includes the heart, which pumps blood through the network of blood vessels to all parts of the body. So in the circulatory system diagram we see here, we have veins and arteries. You can see the strong, thick, red tube-like structure in the center of the midline is the aorta artery. Then you can see inferior vena cava, which is a major vein, which is in blue. Then you have your lungs and your heart. Those all consist or are all components of the circulatory system. So how does the flow of blood work? Blood picks up oxygen in the lungs and goes to the heart. The heart then pumps it to the rest of the body. The cells absorb oxygen and nutrients from the blood and release waste products. Blood then carries the waste back to the lungs and to the kidneys. In the lungs, the blood exchanges the carbon dioxide for more oxygen. The heart consists of 4 chambers. These chambers work closely together to pump blood to the lungs and to the rest of the body. There's 2 upper chambers and 2 lower chambers. The 2 upper chambers are called atrias, or atriums, and each lower chamber is called a ventricle. In between these chambers, there's one-way check valves that allow the blood flow to only go in one direction. If in fact the blood flow does go back to one chamber, or what they call regurgitate, you may be having a problem called a mitral valve prolapse, or any other valve that you guys do not necessarily need to know, but there is some type of issue with one of those valves, which is why the blood is regurgitating back into one of the other chambers. So here in this diagram you can see the different types of chambers of the blood flow. The oxygenated and deoxygenated blood. We see in red that would be oxygenated, and blue it's deoxygenated. Obviously, arteries and arterial blood splatter is bright red blood, and all your veins that you see in your hands and your arms, they're blue because they're deoxygenated. The little white fluffy things in between the chambers are your valves. As you can see the arrows of the path through the blood there, you can see that the blood is supposed to only go one way, and that we shouldn't have any of that regurgitation into any of the atria or ventricles, which obviously would mean that there would be some type of medical problem with one of or some of the valves there. Keep in mind that arteries carry blood away from the heart at high pressure and therefore have thick walls. When you learned in CPR of 3 major arteries, you do know when you're checking for CPR or performing CPR, we're going to check primarily the neck or the carotid artery. We also could check the groin or the femoral artery, and we could check the wrist or the radial artery. And does anybody know the artery we would check in infants? That would be the brachial artery, which is located in the upper arm. So here is a diagram of where the arteries are. So we have the carotid artery that's located, like I said, in the neck. You can check on either side. And then in the femoral arteries in the groin, you can also check on either side, as well as the radial arteries, you can check on either side or either extremity. Capillaries are the smallest vessels of the circulatory system. So I know when I used to teach this in front of you guys, I would have you pinch your finger. Like let's say you take your thumb and your pointer finger and you push down onto one another hard and really fast. You can see where your skin turns white and then returns to normal color. That is an indication that your capillaries, which are the smallest vessels in your body, have adequate capillary refill, which means you are oxygenating and circulating blood at a normal level. If you were to do this, what we call a capillary refill check on somebody who is having difficulty breathing, is in cardiac arrest, you will see that this capillary refill will be extremely decreased or not present at all. When we look at veins, you can also check your forearms and check and look at your veins on your hand. Veins are the thin-walled vessels that carry blood back to the heart, and they're not oxygenated, which is why they are blue. With that said, blood has several components. We have plasma, white blood cells, white blood cells, red blood cells, and platelets. And here's just a photo of a composition of blood when you get it drawn, and how once it goes through what they call a centrifuge to separate each component of blood of what it looks like in the vial. Then we move on to the skeletal system. The skeletal system consists of bones and is the supporting framework of the body. It has the 3 major functions: to support the body, to protect vital structures, and to manufacture red blood cells. In this diagram, you can see the skeletal system and all major bones located within the body. Does anybody know what the strongest bone in the body is? Well, since I can't hear you or get an adequate assessment on whether or not you know it, I will just tell you that it's the femur, the upper thigh bone. The skull and the bones of the head include the skull and the lower jawbone. The skull consists of many bones that are fused together to form a hollow sphere that protects the brain. And then there's the jawbone and the movable bone that is attached to the skull and completes the structure of the head. We all have 33 vertebrae. We know that the spinal vertebrae are stacked on top of one another and are held together by muscles, tendons, discs, and ligaments. Now, I know some people can get confused on what a tendon or a ligament is, so we're going to go through and discuss what the difference is. So, a tendon is a flexible, inelastic cord of strong, fibrous collagen tissue. The key here is attaches a muscle to a bone, whereas a ligament are bands of tough elastic tissue around your joints that connect bone to bone. So that most likely will be a quiz question at the end of this. Okay, so if everyone knows what a disc is, we all know what muscles are. Alright, so the spine cord passes through the hole in the center of each spinal vertebrae, and the spine has 5 sections. Some common terminology used for the 5 sections of the spine are cervical spine, which is also known as C-spine, which is the neck. Thoracic spine is your upper back. Lumbar spine is your lower back. Your sacrum is the base of the spine, and the coccyx is the tailbone. And that just breaks down in a beautiful, colorful picture of what I just showed you. So if somebody, let's say a quiz, and the end of this says, okay, somebody has lower back pain just above the coccyx, what term would we use to describe what area of the skeletal system this would be? Sacral or lumbar? Good. All right. So we have shoulder girdles. Each shoulder girdle supports an arm and consists of 3 bones. You have your collarbone, the clavicle, which is located on the interior of you. You have your shoulder blade or scapula, which is actually located on the posterior of you. And then you have the upper arm bone, also known as the humerus. The forearm has 2 bones called the ulna and radius, and the wrist hand consists of several other bones. Your rib cage has 12 sets of ribs that protect the heart, lungs, liver, and spleen. And you can see in the diagram here, you can see the 12 ribs. You see in blue some cartilage, and then you have the xiphoid process and the sternum. The pelvis serves as the link between the body and the lower extremities. It protects the reproductive organs and any other organs located in the lower abdominal cavity. We already discussed the thigh bone or femur is the longest and strongest bone in the entire body. We know that the legs have 2 bones called the tibia and fibula, and then there's a small bone on the kneecap which is called the patella. And then the ankle and foot have a large number of smaller bones. So joints are where 2 bones come into contact with each other, and that's where a joint is formed. They are held together by supporting tissue called tendons and ligaments, and they are lubricated by a thin fluid that is contained in a sac surrounding the joint. That's why sometimes when you stand up and you bend your knees quick and you hear that pop or snap, that's just the lubricated fluid that's surrounding the joint to make it all fluid and move nice and easy. I bet if you stood up now after sitting at your desk for the last couple days listening to us talk about EMR, you'd hear a pop. Alright, so there's 3 types of joints. There's fused joints, hinge joints, and ball and socket joints. That's the end of it for an error. Let's just get rid of that, Shay. 18, 20. Alright, so now we're going to move on to the muscular system. Skeletal muscles provide support and movement, allowing us to alternatively contract and relax. And skeletal is voluntary muscle. So smooth muscles carry out automatic functions, which are also called involuntary muscles. What does that really mean? Well, do we really have to think about moving our arm, or do we just move our arm fluidly? They're automatically moving based off of our brain and spinal cord and transmitting our thoughts into our body to get them to move. Keep in mind, cardiac muscle is found only in the heart. So we're moving on to the nervous system. So the nervous system governs the body's functioning. Now we learn at the range that the brain is the central computer. And what does that really mean? Well, it does all of our thinking and our movements, right? And it consists of the brain, the spinal cord, and the individual nerves that extend throughout the body. So here we see in this diagram the sensory and motor areas of the brain. It consists of the brain and the spinal cord. We have peripheral nerves. We have sensory nerve endings in each extremity, which means we can feel hot, cold, touch, sensation, and so forth. We have motor nerves to muscle in the forearm. All of these things help us think about our next move and move our body. So again, the brain is the body's central computer, and it controls these functions: thinking, voluntary actions, and involuntary actions. The spinal cord is a long tube-like structure that extends from the base of the brain. Now, the digestive system digests food, breaks it down, and it is broken down into a form that can be carried by the circulatory system to the cells of the body. The circulatory system, again, is the heart, the lungs, and the arteries. So food that is not used, it is eliminated. So the digestive system begins with the digestive tract. It starts at the mouth and then ends at the anus. So in between the mouth and the anus, we have the throat, esophagus, stomach, small intestine, large intestine, and then the rectum. And then you see here in the diagram everything I just explained. You have the mouth, the pharynx, the esophagus, the liver, the stomach, the gallbladder, and so forth. If you have any questions regarding what each of the structures of the digestive system are, feel free to reach out to me or feel free to research in the booklet on what those specifically do. Then we have the genitourinary system, which is responsible for the body's reproductive functions and for the removal of waste products. Major male reproductive organs include the testes that produce the sperm and the penis that delivers the sperm. For the major female reproductive organs, we have ovaries that produce eggs. We have the uterus that holds that fertilized egg during pregnancy and grows the fetus. Then we have the egg released by the ovaries and travels to the uterus through the fallopian tubes. And then we also have the external opening of the female reproductive system, also known as the birth canal, called the vagina. The removal of waste products begins in the kidneys, which filter the blood to form urine. The urine flows down from the kidneys through tubes called ureters into the bladder. The bladder then collects and stores the urine before it passes out through the body through urination out the urethra. We also have skin that covers the entire body. We know that it protects the body against harmful substances in the environment, where we regulate body temperature, and it transmits information from the outside environment to the brain. Is it hot? Is it cold? Does it hurt? And so forth. The dermis is the deep or inner layer of the skin, and the epidermis is the outer layer of skin, which is located upon the dermis. And that was a long statement that may be confusing, so let's look at a diagram to determine what that actually meant. So, if we look at our skin, the outermost layer is called the epidermis. That's closest to the outside. So if you look down at your hand and you slap it here, that is called the epidermis. If I was to cut myself and I was to see some more skin kind of deep in there, but we didn't quite get to the fat just yet, as you can see on the diagram, there's some fat called subcutaneous tissue, then we would know that the skin that we're looking at in there is just the dermis. If we were to go all the way down and we see some fat, subcutaneous tissue, and then something that's pink beneath the subcutaneous tissue, we know that we have a really, really deep cut and we are almost to the muscle. So obviously, a Band-Aid isn't going to fix that, and we're going to need to go get some stitches on that and repair that. Then you can see in the diagram there's sebaceous glands, erector pili muscles, nerves, a sweat gland, hair follicles, and a bunch of other stuff. But the key here is to understand the epidermis and dermis. So the skin is that effective barrier to bacteria and viruses as long as not broken by injury, which is why we wear our protective measures like gloves and gowns and stuff like that. We can perceive touch, pressure, pain, and degrees of hot and cold. Now, as we age through life, things are constantly changing. So when we are first born, we know that infants' airways are very small, and their airways are easily obstructed by swelling or objects just due to the size of it. We should also know that because toddlers, as they grow, have poor coordination and balance, and they are at a higher risk for falls. School-aged children are physically active and prone to injuries from bicycling, riding, or other athletic mishaps. Adolescents do not fully understand the consequences of dangerous actions, and in early adulthood is the period when most body systems are fully developed. Middle adulthood is generally the time when bodily systems start to decline. During late adulthood, these declines become more pronounced. So as we age, keep in mind that we have changes in not only our skin and our vital signs, which we're going to get into next, but other things change as well, such as your systolic blood pressure. So here, common vital signs. We have pulse, which is your heart rate, your respiratory rate, which is how many breaths per minute you take, and your blood pressure. Here in this diagram, it's important to know that vital signs and baseline values, and we need to know what is normal so we actually know what is abnormal. So if we look here, when you are an infant, newborn to age 1 year, your heart rate is going to be anywhere between 100 and 160 beats per minute. Your respiratory rate will be anywhere between 25 breaths to 50 breaths per minute. And your systolic, which is your top number, blood pressure is anywhere between 50 and 95. As you get older and you become a child between the age of 1 to 8 years of age, your pulse rate is going to change to 70 to 150 beats per minute. Now that's a pretty big range. Your respiratory rate could be anywhere between 15 and 30 breaths per minute. And your blood pressure, systolic top number, is anywhere between 80 and 110. Now, adults, which is all of you, because we all work for a living, our heart rate is anywhere between 60 and 100 beats per minute. Our respiratory rate, 12 to 20. And then our systolic blood pressure, anywhere between 90 and 140. So if you and I were sitting here taking this class, which we all are doing, and your heart rate resting is at maybe 120, 130 beats per minute, I'd be a little bit concerned. That's not normal. If you're breathing at 50 breaths per minute and you're just sitting here taking this class, I would also be concerned. However, if I had a newborn infant next to me, I wouldn't be concerned because those rates are normal. So it's just important to know what a typical vital sign value based on age is so we can determine whether or not the patient is in actual stress or distress or if things are normal. Keep in mind, though, if somebody has high blood pressure, that may be a reason for why, their pressure is high. Or let's say somebody just went running. That's a reason for why respiratory rate would be higher. Or let's just say somebody has some really great athletic conditioning and their heart rate is resting at like 40 beats per minute while sitting at the desk. Not necessarily at the high end of over 100 beats per minute for an adult, but on the lower end. That may just be normal for them, and it's always a good thing to ask them if that's normal. So on this next slide, you can see factors that change vital signs. Fever, exercise, illness, pain, stress. Are we overweight? Are they overweight? Or decreased vital signs, blood pressure medications, or athletic conditioning.